Good day, everyone. This is Dr. Ayuba Mugana, an endocrinologist. This series of lectures are for doctors, nurses, and other health personnel. It is aimed at giving you the necessary information that you need to ensure that every diabetes patient you come across is safe during the period of Ramadan fast. So we are going to be taking series of lectures that will equip you with all that you need, all the knowledge that you need, that you guide a diabetes patient on Ramadan fast to ensure that they do not come up with any complication. So today we'll try to introduce this topic by discussing the physiology of fasting. It's only when you know the things that happen in terms of glucose homeostasis during fasting that you'll be able to manage the diabetes patient or guide the diabetes patient properly. So we'll follow this outline. Okay, so by way of introduction, we all know that Ramadan is the holy month of fasting observed by Muslims worldwide. It is a spiritual or religious observation. So it normally takes about 11 to 16 hours of fasting without water or food, depending on the part of the world you are. In Nigeria, averagely it takes about 13 hours. But we should also be aware of medical fasting. That is the period that you advise your patient to stay without food before you check for fasting blood glucose, which is between 8 to 12 hours. So the patient should fast at least 8 hours, and that's how you'll be able to get your fasting blood glucose. So there are about 148 million Muslims that are living with diabetes, which is a very big number, and of which most of them, 160 million, choose to fast. So it is very important that you, as a medical doctor or health personnel, do not insist that a diabetes patient should not fast. It's not in your place, but it is in your place to guide them properly to avoid complications. Right, so the guidance of the clinician, the doctor, endocrinologist, the diabetes nurse, and other health personnel are extremely important to prevent the occurrence of complications. So the major question that I have received, and most of you doctors have received, is: should diabetes patient observe Ramadan fast? So most diabetic patients, most people living with diabetes, should be allowed to fast and should be guided on how to do so. Diabetes patients are at risk of complication during that fast, so that guidance is extremely important. But you can only guide the patient if you have the necessary information and knowledge to do so, because we do not want a situation where the blind, right, somebody that does not have information, tries to guide an uninformed patient. So it is a period of both benefits and also risks, because we have observed increased morbidity and mortality for diabetes patients during that period because of lack of proper knowledge. Hence the necessity for this discussion. As I said, it has numerous benefits for the diabetic patient if it is done the right way. But if it's not done the right way, it comes with morbidity and mortality. So we'll discuss normal glucose homeostasis during fasting. We'll talk about inhibition of insulin secretion, glycogenolysis, gluconeogenesis, and ketones production. So for insulin inhibition, when the blood glucose is going towards low levels, the body begins or activates the protective or compensatory mechanism. So generally, when the body sees danger in terms of hormonal balance, it tries to balance it. It tries to counter that imbalance. So, and that's why you have inhibition of production of insulin. And it is the first step in the process of prevention of possible hypoglycemia. And this is only done through the action of the glucose sensor on the beta cell. So the glucose sensor, which is the glucokinase, sends when the amount of glucose that is going through the beta cell is reduced. Therefore, when it senses that, it stops the processes that are involved in the production of insulin. And this process of insulin inhibition usually starts when the blood glucose is less than 4.4 millimoles per liter, so as to prevent the continuous reduction in the blood glucose level and possible hypoglycemia. So after that, insulin production is inhibited. So when insulin production is inhibited, the ratio of insulin to glucagon is reversed, where you have more of glucagon than insulin. And when you have more of glucagon than insulin, there will be the process of glycogenolysis, where there is breakdown of glycogen to glucose. And this is through the action of the glucagon and some extent the epinephrine. So glycogenolysis is usually activated during fasting and sometimes during interprandial period, especially if the interprandial period is longer than necessary. So the process of glycogenolysis usually occur in the liver and also the skeletal muscle. Though the glycogen store is higher in the skeletal muscle, however, the ratio of glycogen is higher in the liver. That what it means is that based on the mass or the volume of the liver and the content of glycogen it has, the glycogen ratio is higher in the liver, though the total amount of glycogen is higher in the skeletal muscle. So the glycogen in the skeletal muscle is used during physical activities. So usually glycogen stores takes about 12 to 24 hours. However, this depends on the physical activity of the individual. If the patient is engaged in strenuous or physical activity, or the patient or individual is an athlete, the period in which the glycogen is depleted it is shorter compared to somebody that is more or less sedentary. So the duration of the depletion is 12 to 24 hours. So, apart from glycogen, the breakdown of glycogen to produce glucose, there's also activation of gluconeogenesis. And gluconeogenesis is also another alternative source of glucose to the patient during Ramadan fast. It uses amino acids, also uses glycerol, and also lactate. So it produces glucose from amino acids and glycerol and lactate. It usually takes place in the liver and to some extent in the kidney, but mainly in the liver. It usually activated in patients after prolonged fasting, usually may last up to 42 hours in healthy individuals. However, it also depends on the physical activity of that individual. So ketone production, this is also another alternative source of glucose, which involves lipolysis and beta oxidation. The process of ketone production occurs in the mitochondria, and it happens when the body has depleted other sources of glucose. Therefore, ketones is used as the source of energy for that individual. So it is also seen after prolonged fasting. So it is after this stage that if there is continuous lack or unavailability of glucose, that the patient will lapse into hypoglycemia and start becoming symptomatic of the symptoms of hypoglycemia, which could be the adrenergic symptoms or the symptoms when it has involved the brain or CNS. So, what is the difference between the physiology of fasting in normal individuals and physiology of fasting in individuals that are diabetic? What is the difference? Is there any difference? Of course there are. Diabetic patients, due to lack of insulin or insulin resistance, have a less amount of glycogen store. They have little glycogen store, and this makes them at risk of the depletion of glycogen to be quickly, unlike other healthy individuals. So that puts them at risk of hypoglycemia. As you will see in our subsequent lecture, this is one of the reasons why diabetic patients are always advised to not to skip suhoor, because of this they do not have enough glycogen store that will take them further. They also may have a problem with the release of adrenaline or epinephrine, which is very important also for the process of glycogenolysis, right? And apart from that, if a diabetic patient has autonomic neuropathy, you may have hypoglycemic unawareness. So when there is that danger of hypoglycemia, that the diabetic patient will not be aware. So our next lectures will be on risk stratification of diabetes patient during Ramadan. I'll see you there.